All right, let's dive into one of the most common, but maybe one of the most intimidating images in all of medicine, the chest X-ray. I know, it looks like a bunch of black and white shadows, but I promise you, by the end of this, you're going to see it for what it really is, a story, just waiting for you to read it.
So, take a good look at this. This is a pretty standard chest X-ray. And right now, it might seem like a random jumble, but it's actually speaking a very specific language. The trick to understanding that language? Well, you first have to learn what a normal story looks like.
And here it is. This is probably the single most important rule we're going to talk about today. You see, the vast majority of X-rays you'll ever come across are going to be completely normal. So our mission, really, is to get incredibly good at recognizing what normal is supposed to look like. Once you've got that down, anything abnormal just kind of pops right out at you.
So, to start reading this story, we've got to learn the alphabet first. And in the world of X-rays, that alphabet isn't A, B, C. It's all the different shades of gray, black, and white you see on the screen.
And believe me, those shades are not random. They actually create a map of density inside the body. Think of it like this. Things that X-rays can just zip right through, like air, they show up as black. But things that block the X-rays, like bone or, metal, they show up as bright white.
So this gives us the 5 basic letters of our X-ray alphabet. Going from the darkest to the lightest, we have gas, the air in your lungs, which is black. Then there's fat, which is a dark gray. Next up is soft tissue and fluid, like your heart, which is a light gray. Denser than that is bone, which is off-white. And finally, the brightest thing you'll see is metal. That's it. Every single image on an X-ray is just some combination of these 5 shades. But just like taking a photo, you can't read the story if the picture itself is blurry or taken from some weird angle. And that's why checking the technical quality of the X-ray is absolutely 100% crucial.
Think of these as 2 different camera angles. The gold standard, the one we want, is the PA view. That's where the X-ray beam goes from back to front. It gives us a true-to-size picture of the heart, and it cleverly moves the shoulder blades out of the way of the lungs. The other one, the AP view, is usually for patients who can't stand up. But it has a downside. It makes the heart look bigger than it actually is. So just knowing which view you're looking at is a huge first step.
So how do we know if we have a good high-quality image? Well, professionals look at 3 key things. Sometimes they call it the RIP check: rotation, inspiration, and penetration. Basically, was the patient standing up straight? Did they take a deep enough breath? And was the X-ray exposure, the brightness, just right?
Let's just zoom in on inspiration for a second. Here's a really simple rule of thumb. You count the ribs. On a really good X-ray, where the patient took a nice deep breath, you should be able to count about 10 of the posterior ribs. That tells you the lungs are fully expanded, and it's giving you the best, clearest view possible.
Okay, so we've learned our alphabet, we've checked the quality of the picture, now it's time for the secret weapon, a system. Having a checklist is what makes sure you look at everything, every single time, so you don't get sidetracked by the first thing that catches your eye.
And this is it, the ABCDEFI approach. I know, it looks like a lot, but this checklist is an absolute game changer. You start with the airway, then the bones, then the cardia, or heart, and here's the genius of it. It forces you to look at all the stuff around the lungs before you even get to the main event, the lung fields. It stops you from falling into that classic trap of spotting one thing and then missing 5 others.
A system's only as good as its application, right? So let's actually put this thing into practice. We're just going to look at a few of these key checkpoints to see exactly how they work.
First up, A for airway. All we're doing here is looking at the trachea. That's the dark tube running down the center of the neck. The big question is it in the middle? Because if it's getting pushed over to one side, that can be a huge red flag that something is either pushing it or pulling it. But in a normal X-ray, like this one, it's sitting right there in the midline. Nice and simple.
Okay, let's jump ahead to C for cardia, which is the heart. When we look at the heart's shadow or its silhouette, we're really asking 2 main questions. Is it too big? And are its borders, the edges, sharp and clear? The answers to those 2 questions can tell us a whole lot.
And hey, there's actually a really simple measurement for this. In a standard PA view, the width of the heart should be less than half of the total width of the chest. If it's over 50%, that might mean the heart is enlarged. It's such a quick and powerful little check.
Now here's a fascinating little detail. Sometimes you might see this super thin black line right around the edge of the heart, and your first thought might be that something's wrong.
But a lot of the time, it's just an optical illusion called the Mach effect. It's caused by normal shadows overlapping in just the right way. It's a great reminder that even a normal X-ray can play tricks on your eyes.
All right, moving on down to D for diaphragm. See those two curved lines at the very bottom of the lungs? That's what we're looking at. We want to see nice, sharp, clear borders. And you might notice that the right side is normally just a little bit higher than the left. Any idea why? It's because the liver is sitting right underneath it, just pushing it up a little bit.
Okay, we've covered the alphabet, we've gone over quality checks, and we've walked through the system. Now let's just bring it all together with two final principles that really take a good reading and make it a great one.
And this right here, this might be the single most powerful habit of all. Anytime you see something that looks even a little bit weird, the very first question you should ask is, was it there before? Comparing the new X-ray to an old one is without a doubt the best way to know if something is new, if it's getting worse, or hey, maybe even if it's getting better. It's your best friend.
And we're going to end on this quote because it just perfectly sums up this whole philosophy. It's a chest X-ray, not a lung X-ray. You can't just stare at the lungs. You have to use a system to look at everything. The bones, the heart, the soft tissues, the diaphragm, all of it. The real story is written in the entire image, not just one part of it. So what are you going to see the next time you look at one?